Welcome to Caring for Patients with Down Syndrome, a professional development series for health providers, brought to you by the Down Syndrome Association of Greater St. Louis and the Global Down Syndrome Foundation. This lesson, How Occupational Therapy Plays a Role with Adults with Down Syndrome, features Dr. Selena Washington.
Hello, my name is Selena Washington, and I am an associate professor at St. Louis University in the Department of Occupational Science and Occupational Therapy. And today I want to briefly talk to you about how occupational therapy can play a role with adults with Down syndrome to lead productive lives and stay healthy and engaged as they move through life. So some of our key areas that we will talk about, they involve education management and health, or education around health, assessments of activities of daily living, home safety and environment modifications, recreation and exercise and balance programs, and assessment and recommendations. The health portion of what we do as occupational therapists. So we understand chronic conditions as occupational therapists and looking at aspects of medication management, nutrition, and healthy routines and outcomes for our adults who are aging with Down syndrome is really vital. This is hands-on education of what happens in the home and also setting goals for what needs to be accomplished. We know that building habits and routines support long-term wellness and outcomes. We also want to look at the assessment of daily activities of living. So this is not only self-care such as dressing, bathing, those type of things, but also life skills, things like managing cooking tasks and shopping roles, and also managing daily schedules. As occupational therapists, we know that it's vital to make sure that our adults are well organized and know what's coming up throughout the day. We want to make sure that these skills are able to be modified as adults age for independent living as much as possible, but then also participating in meaningful activities within their life. With occupational therapy, we know that in doing modifications around the home is key. And so when we talk about that, of course, we're going to look at what is happening with flooring. So anything that's dealing with flooring, anything that's dealing with footwear, those things that may put an adult at risk for trips and falls, we want to make sure that we're assessing for. We know that fall hazards happen commonly throughout the household. And so we want to make sure that if needed, that we're putting reflective tape in areas that have different raised levels, or if there are stairways where the depth perception is compromised, we want to make sure that we're putting in those modifications, whether it's reflective tape or any of those things that will help with that, to monitor our adults as they go up and down the steps and they navigate throughout the house. We also want to look at if grab bars are needed. So grab bars are truly essential within the bathroom as far as getting up and down and out of either from the toilet area or from the shower area, just making sure that our adults are safe as they navigate around the bathroom, and looking at lighting in all areas. So we know that low lighting is always a potential risk for not being able to see what's ahead of you and not being able to transition around the home. And so we want to make sure that the lighting is adequate enough for our adults to remain safe. Looking at reducing pattern backgrounds. So whether it is a rug that has multicolors that's hard to navigate as far as when an adult is walking throughout the home, or if it's difficult to tell what is the end of one surface and the beginning of another, we want to make sure that we identify those areas well. And keeping clutter down as much as possible. Of course, our adults are living as independently as possible, and we want to make sure that things are well organized. So areas such as keeping shoes in place and keeping where clothing goes, if it's clean or dirty or whatever it may be, making sure that all those areas are labeled and organized. And of course, this is something that occupational therapists can help with. Looking at the outside elements of the home as well are vitally as important. So making sure that railing is in place, making sure that if outside lighting is adequate enough for our adults to navigate coming into the home is something that we need to keep in mind as well. We want our adults to maintain a really rich quality of life, and occupational therapists are the best people to do that. We look at recreational activities, we look at exercise and balance and movement programs that our adults can participate in. And so things like adaptive sports programs, if it's adaptive sports, maybe swimming or bowling, which are excellent for coordination and cardiovascular health, and also encouraging that teamwork among their peers is something that we can offer and make modifications through. But there are also programs that we can recommend, such as the Special Olympics or community centers that are tailored to fit our adults' needs. Also, looking at how outdoor activities, we know that exercise has been proven to help with cognitive health as one ages. And so we want to look at exercise as a form of helping our adults stay active, but then also helping with that brain health. Using either outdoor games, but then also virtual games. And so we look at different virtual games that encourage movement and exercise. Those are things that we can recommend. And movement is key. So we know that regular movement builds strength, supports memory, and it regulates the mood within our adults who are aging. We work with individuals to really assess what they would like to do. It could be dance or music or yoga, whatever activities are available. But our goal is to do those initial assessments to try to figure out between our adults who are aging with Down syndrome and then their caregivers to assess what is of interest to them. We want to look at how can one remain socially engaged. And so one of the programs that I've had a pleasure of being a part of is Circle of Friends. And this is a program where our adults get together and talk about things that interest them. It could be areas of entertainment, but then it can also be between games and recreation activities that the Circle of Friends that usually consist of maybe 5 to 8 peers that have a shared like and interest. The occupational therapist can be a leader of this group as well as other professionals, but we can very much tailor what is vitally important to those adults and how we can engage them in activity as a peer group from day to day. How do we assess? Let's say as our adults are aging and things begin to change, mood or appetite or sleep or mobility or even cognition. We want to make sure as occupational therapists, we are providing those tools for caregivers to notice what is happening or if something is changing, how to monitor those changes as time goes forward. And so some of the more common things that we do, of course, as occupational therapists, we assess for gait, walking, and balance issues that may arise. So if we notice that now maybe Jimmy is displaying some issues with a shuffling gait and not moving his feet to clear the ground as readily as he used to. Those assessments come in play because now we can look at, okay, what is happening? Is he having issues with slowing down in certain spots? Or is he having issues with maintaining his balance when he's going from a hard surface to, let's say, a grass surface? And we want to make sure that we're noticing those changes and helping caregivers realize those changes are occurring as well. So identifying not only environmental hazards or environmental changes, but looking at gait, walking assessments, and also using balance assessments to really monitor what's happening with our adults.